Hello, this is Dr. John Daly, Chief Medical Officer of COLA. I would like to discuss a molecular technology that over the past few years has rapidly assumed a place in our laboratories. It is the analysis of cell-free DNA, and the technology is commonly referred to as liquid biopsy. The DNA being analyzed is not obtained directly from a traditional tissue biopsy, but rather from a non-solid biological tissue, principally blood and plasma. Today, this technology is being utilized to detect and analyze cell-free tumor DNA obtained from the blood of patients with known neoplasms. The technology is also used in screening for certain fetal genetic mutations from the cell-free fetal DNA obtained from the blood of the mother during pregnancy. Traditionally, when we think of biopsy, we envision a portion of tissue being removed from the patient, processed in a histology laboratory, and the microscopic slides of the tissue being interpreted by a pathologist. However, in the case of liquid biopsy, there is no need for an invasive procedure on the patient, since this technology allows molecular analysis of the DNA free in the plasma of the blood. The DNA abnormalities in neoplastic tissue, which have been discovered over the past several years, are now allowing patient plasma to be analyzed for early detection of tumor recurrence and chemotherapeutic resistivity mutations. In many instances, the tumor recurrence can be determined prior to its being clinically evident, thus enabling initiation of appropriate treatments at an earlier time. In the case of maternal blood screening for in utero fetal genetic abnormalities, the test is available after 10 weeks of pregnancy, and blood obtained from the mother is analyzed to detect fetal genes in the maternal plasma indicative of fetal genetic abnormalities. For example, trisomy 21, indicative of Down's syndrome. Today, this test is considered a screening test. However, it enables the identification of fetuses with genetic abnormalities in need of definitive diagnosis. It is a new world in medicine. There are advances published on an almost daily basis that will enable additional use of molecular technology in the identification and treatment of many diseases. Thank you for your attention.